Hi folks, my name is Toby, Lineaweaver, and this is Alyssa, Horton. And today we thought we'd talk about supporting families who have a loved one who may have an addiction. They're concerned, they'd like to know how they can help the loved one, and it can be pretty overwhelming knowing even where to get started. So you, as an outreach person, you get a lot of these initial calls. So
yes, I do.
What's the state of things when you get that first call? Usually people are just at the beginning reaching out, or they...
It's all stages. They're reaching out, whether or not it's been the first time, the 5th time, 20th time. Families are still always in a state of almost panic.
Okay, so it almost doesn't matter sometimes that they've been through this before, that they present to you, feeling overwhelmed and needing support.
Yeah.
Okay, so what are some of the most common questions you get after help?
After the initial, can you please help?
Yes.
It depends. That's where it starts to get a little different. So whether or not it's what can you do to help is typically somebody that's already had some experience with treatment.
Mm-hmm.
And then there's the what do I do? So
Okay.
it's typically like, what can you do or what do I do are the next question.
Okay, so I got a call the other day, maybe you were in on this too. So-and-so is in the hospital and he just had an overdose.
Yep.
And we really need to get him into treatment, so please call me back right away and help me out with this.
Yes.
Okay, so where do we start with something like that?
So obviously we always call a family back, kind of try and gauge from their point of view what's going on. We reach out to the individual, try to gauge where they're at.
Okay, so with the family though, so this is often the mom or the dad calling and they're in a high state. My son just overdosed, my son or daughter, they're in the hospital.
It's terrifying.
So how do you talk to them?
Well, absolute empathy. I can't imagine being a mother or father and having their child almost die due to an addiction that they don't understand. It's terrifying. So we try to console them to the best of our ability and also, gauge where their loved one's at and try to see where we can assist.
So what you're making me think of is almost like you're approaching it on two levels. One is a person in panic or in dire emotional straits is often in a place where they can't have a level head and be thoughtful about what the best thing to do is. And you have to spend part of your time kind of helping them regain emotional control and calm them down a little bit.
Yeah.
While at the same time gathering facts about the situation so you can have an answer when you finally get around to it.
Absolutely.
That can be kind of tricky though when people are in high emotion and you're trying to gather facts at the same time.
Yeah, and I mean, it's not always necessarily facts. It's perception of a situation. It's their needs and their wants, and then trying to understand what they think the loved one. Usually because they're in such a heightened state too, though, we become... Because I'm the same way. If I'm in a heightened state and I'm terrified and in panic, I know that I'm not going to think logically.
Right.
But because I'm in such that heightened state, it's almost like I'm so cautious I can pick up on things much easier around me. Okay. So most of the time, the information they're giving is actually pretty more accurate than most.
Okay. What kind of things are you going to say to parents, though, to help get them calm down a little bit so you can work more effectively together?
Validate their feelings. I mean, the truth is that I can't imagine what they're going through, so I never say, I completely understand. I don't.
Okay.
I have no idea.
So some of those feelings, might they include also anger?
Oh, absolutely.
Yeah.
It is a lot of mixed emotions, I think, that initially it's panic and worry, and then anger may come in, or absolute terrifying, paralyzing fear.
Okay. So you normalize, validate, sympathize, try and get them to calm down a little bit?
Yeah, I try to look at it more so, like when I'm dealing with a family, it's more of a human approach than it is anything clinical.
Right. Who says clinical's not human now? Come on, I gotta take exception to that.
No, meaning I try to not be as
like a therapist
strategic.
Analyzing them.
Right, I'm not trying to be so strategic in the conversation, more so just because I feel like, as much as a clinical approach is, connection is important. For a person in a heightened state, I think the fact of taking away that and just being able to empathize as a human being to a human being.
As a clinician, I'm going to choose not to take umbrage with those remarks.
Well, you're an exception to a lot of rules, too.
As if we weren't interested in connecting with the people. Okay.
No, that's what I said. Connection is huge as a clinical approach, but as opposed to me trying to analyze the situation, it's taking away any wants from the conversation,
Right. Well, this brings
even
up
to produce anything for them.
it brings up an interesting point, is that aside from the fact that their kid might be in really big trouble, they're in the hospital, they overdosed, or they're missing on the streets and all that kind of stuff.
Yes.
That if that isn't traumatic enough, what so often happens to parents when they interact with the agencies and the authorities is that they often come away feeling judged as being bad parents because their kid is screwed up and addicted. And I call that the secondary trauma. And a lot of parents are interacting with us with that in the mix, feeling defensive, feeling guarded, kind of hyper alert to being judged, or to being told what to do or lectured. And, if I was in their shoes, my doors would slam shut and I wouldn't want to talk to anybody, especially a clinician, God forbid. So it's really trying to also make sure that whoever they're connecting with is someone that's really on their side and cares about how they feel and is not judging them. And that's why, as I've repeated, ad nauseum in so many other talks, I never use the word enabling in polite company, because the last thing these people need is to feel like somehow it's their fault that their kid is in trouble,
Yeah, no.
Okay. All right, so we're on the same page about that, even though
Toby, I have worked with you for some years now.
Okay.
I have officially removed that word from my
All right.
vocabulary.
Okay, I'm done making you suffer. Okay, so then comes a lot of quick thinking about what best to do for this person.
Absolutely.
And so what are some of the things that go into that mix for you?
Well, first you have to gauge the willingness of the individual.
Right.
Sometimes
Okay, so we have a fork in the road, willing, unwilling. So let's go down the willing fork first, okay?
Perfect.
All right.
Identifying what level of treatment that they need, whether it be detox, rehab, outpatient, whatever they would qualify for. If it's an overdose, it's most likely, obviously, a detox. But then I would start working on gathering resources for that individual based on their needs.
Sorry to say, we always have to ask about means to pay, right?
Right, so it's insurance-based, but also, if there's any private pay options, or if it's state-funded and they have no resources. So part of my job has been to gather all that information that's available in New England and provide that to anyone that's called.
So you have a Rolodex in your brain.
I do. In my phone.
And in your phone. And so that's down the willing path, right? And could be geography, it could be the type of insurance. Now, by type of insurance, obviously we're talking about, like a Mass Health, a state-funded product that not all places take Mass Health, but some do, and so that's where we would have to steer them, okay? And private insurances, they have more options, right? Okay.
Well, it's more so in Massachusetts. It's not very easy to make a referral for somebody with Mass Health insurance. It actually doesn't happen.
What you saying, there aren't agencies, or there are though? There's
agencies that take their insurance, and I can provide the resources and information, but I can't actually call the provider myself, which is where private has the upper hand in that sense, because it's very hard to make those calls yourself and to actually follow through with an intake.
You mean
and
as a client?
As a client, yeah.
Slugging through all the different phone calls.
Right, all the different steps to just getting into the detox. So sometimes, with private insurance, it's much easier for us to be able to do that. That's really the only difference. I can provide 10 to 15 different locations in Massachusetts that accept your insurance without a problem.
But if you have Mass Health, then it's limited.
It's actually, they have a lot more options as far as how, the number of treatments.
Right.
There's only a certain amount.
Where is it limited?
Limited in the sense that I can't take care of the admission process for them.
All right, so they're kind of on their own. You give them a number and say, here, call this place.
That's why when somebody calls, I try to ask if they have supports, if there is family that can at least be there, to cheerlead them on through the process. I call back most of the time to try and check in and make sure that they make the calls myself.
So you're not abandoning them just because they don't have the private insurance.
No.
It reminds me of kind of the role of the special education advocate when I was working with special needs kids, that the parents would get so overwhelmed by the bureaucracy and the labyrinth of services, and that they were so elevated because they're so worried about their child that they needed someone that held their hand and can think things through and guide them and support them, and that's a role that you perform.
I try to the best of my ability. If the
Yeah.
person will allow me. Most of the time they do. I
Okay.
always just divulge like I'm a person in recovery.
Okay.
And a lot of my history was I had no insurance when I got sober. So
Okay,
I've
so
been
you know
there.
of a thing or two.
I know
All
I
right.
do.
So a thing or two of what you speak. So when you deciding on levels of care or helping parents decide what the best level of care is, you know, you're not a doctor, so you don't provide medical clearance,
No.
but you have your instincts and your experience. So generally speaking, what are we looking at? Most of these people are going to need to go into detox.
Most people need to go into detox, if not 99.5%.
Okay, and of those people that go into detox, that averages for how long, and then what's the next step?
Depending on what you've been using, it's 3 to 7 days. Alcohol being the least amount of time needed in detox, and benzos. Again, it's only based off medical necessity, so as long as you're showing signs of withdrawal, then they can medicate you for it, your insurance will cover.
Now, okay, I'm asking a leading question. I know you know the answer to this.
Go for it.
Someone who's withdrawing from opiates, is their life in danger from the process of withdrawing?
So technically, to insurances, no. There's not a fatality that will come from withdrawal. You'll feel like you're dying.
Yes.
But medically, it has been determined that you won't.
Okay. Yet with alcohol, interestingly,
You could die.
you could die.
Yes.
That is true here, is that the greatest concern around medical clearance and stabilization is around people that are withdrawing from alcohol or for benzodiazepines, which one psychiatrist described to me as actually alcohol in a pill form, and withdrawal can be quite dangerous, even medically fatal, if not managed properly. So we have had people that presented to us that had not had a drink in X amount of hours or even parts of a day, but we still had them go to detox because
absolutely.
people sometimes will have the seizures, and it's quite scary when that happens. Okay, so so that was the willing path, and now for the unwilling path. All right.
This is a hard one.
This is a hard one. Okay, so you know, my son's or daughter's overdosed. They're on the street. They're out using again. What do I do? I'm trying to get them into treatment, but they're not interested, or they AMA'd or left against medical advice in the last place they were at. So that's the trickiest one of all, right?
Oh, this.
Okay.
Yeah.
Don't sound so excited. Let's see if we can help these people.
Exactly. So it's the hardest one because it becomes with the two most complicated factors. Family really wants the client to be willing, but the client's very unwilling. And as we all know, we can't force change without some kind of interference. So one option is to section somebody, but you have to be what I really try to work with families is like, where are you at?
Okay.
What are you willing to do?
So before we go forward,
No,
we're
what
going to talk
section
about the
is-
sectioning. Okay, so
it's a little traumatic.
there's two kinds of statutes provide for involuntary committal
In Massachusetts.
In Massachusetts, one is of course Section 12, which is it's actually permits involuntary transport to a hospital. That's Section 12, or the so-called pink slip. And that's for people that are imminent danger to self or other through some psychiatric or mental health emergency. And once presented at the hospital can screen them in and hold them against their will, refer them out for services, and sometimes they screen them out.
And a lot of places now in Mass, you do have to be present in the hospital to be able to do a section 12.
Okay. So Section 35 is a involuntary civil commitment. And roughly speaking, what happens is a family member would go and take out a Section 35 petition at a courthouse, and it would be presented to the judge, and the judge would determine whether or not they would honor it, and if they do, they issue a warrant for that person.
Bench warrant.
Bench warrant, and it's only good for 24 hours, right? So if they find that person, then they arrest them, and then they bring them to the Section 35 units. Now there's MATC for men.
Well, actually, so families should know these details, that when you do that, they bring them into the courtroom and they can try to fight their own case.
Okay.
So even when you desection somebody, it's been really hard to explain to families in Massachusetts that sectioning does not necessarily mean your child or loved one will end up in a holding facility if they can present that they're not a harm to themselves due to drugs or alcohol.
Okay, we know how convincing people can be
Yes.
when push comes to shove, but that's presuming they know they're being sectioned. You know, if someone's living in one town and the court is in another, they won't know until the police come and get them, right?
Right, but they do that after. Their bench warrant brings them into the courtroom. They're presented in front of the judge, and then if determined that they should receive services, that is when they start to look for services, whether it be MATC, WATC.
So MATC stands for Men's Addictions Treatment Center, WATC is Women's. Those are in Brockton and New Bedford, respectively.
Yes.
And then there's a new one, right? Somewhere?
I think so.
Okay, well...
Unfortunately, I do. It's a standalone program that's usually used for mostly all sectioning, and a lot of people do that so they're full, so we don't usually use that as a rule.
Right, so what is the reason why we would go to that extreme step of sectioning someone?
I tell families, a big part of my conversation again is that I talk with families about where are they at. When you do section someone, you are getting a bench warrant, but it does again feel like they're being arrested, which can be traumatic for your loved one. If you're at a point where you're literally terrified that they may die, it's not just a basic fear, like they're literally using or drinking to a capacity that they will...
That life is in danger.
That life is in danger, and you feel comfortable enough to insert that as a resource, then you do it. If not, the ramifications of making that decision, not so much of what happens if they get mad, if they get angry at you, it's more so how you feel about it afterwards. Because if you're riddled with guilt after making a major decision like that will affect your loved one. What I've seen is almost it's a huge pushback to not as being effective because you're now feeling guilty that you took that step.
That gets into also the powerless, helpless thing, and and that's something we can talk about later if we have time for it. So really we're talking about safety and imminent danger to someone's well-being.
And again, the family has to be in a position where they're okay to make those calls.
Okay.
And then otherwise, it's the powerlessness.
Well,
it's trying to explain and help to the family best ways to coach them, best supports they can find locally so they don't feel alone while they're in this. Maybe different therapists in their own area that they should begin talking to and getting resource from them. But a lot of the times when an individual is unwilling or a loved one's unwilling to go to treatment, besides sectioning, there is nothing by law that they can do to change that person's mind.
Right.
Most families want to go on, to play to the emotions, right? They're very heightened, they're very upset. Unfortunately, again, you have to think of your loved one or the person that's afflicted with addiction is not coherent.
They're irrational.
Right, they're not attached. They're not emotionally attached. They're not mentally attached. It's talking to an insane person when you're coming to them with sanity. They're not going to understand or comprehend. It doesn't mean they don't love you. It doesn't mean that they don't care for you or don't respect you. It means that they're in a position where they're incapable of showing you.
Right. They've lost the ability to make an informed consent or a rational decision. So, all right. Well, that's really sounds bad when families are in that situation. It's really tough.
Horrible. That's why I was like, ugh, because that is the worst call I get because it's delivering, in my opinion, extremely harmful news.
Well, it's awful to hear, yeah.
Right, it's awful to hear. It's like when you call, you expect to gain hope, and that's what I like to give people. But sometimes the reality is the situation that you're currently in, there is nothing you can do. And it's an unfortunate part of this disease. Like, we not only are people like myself a person in recovery, like am I afflicted, but it's everyone around me. We're all very powerless.
I'm sure your parents felt the same way.
They felt powerless.
Yeah.
They felt powerless and hopeless.
Well, what was it got you to turn around? Was it something they did?
For me, my story was that they kicked me out and shut me off. The only thing that they would permit is I love you texts with no response.
From you to them?
Nope.
From them?
They would say I love you, and I would try to be extremely manipulative and try to get things back because I was obviously struggling being homeless. But they wouldn't.
Was someone coaching them to do that?
So my mom was attending a support group through a local treatment center back where we live, and my dad was in recovery himself, so he had the support of his network.
Okay.
So they were, and my family was a very much united front. Nobody was going to help me.
So here we are talking about some of the strategies. Really, is one is that families need to be united in as best they can around a common strategy, because if the addict knows that there's someone that can be turned to their own end and manipulated, they will find that person and they will do that, and then everybody else's efforts will be for naught. The other thing is setting, I guess, boundaries. I hate that word because, but setting limits against manipulative behavior.
Yes.
And of course, when your parents would set limits against your manipulative behavior, of course, what would you say? You don't love me, you're not listening to me.
Yeah, you hate me, I'm just gonna die.
Right.
Playing on their
I actually had a client recently say, well, I'll just be on the street, homeless, and then I'll die, and you can live with that for the rest of your life.
Yep, that's a very, that's a go-to.
Now, you think that was the person talking or the addict talking?
The addict.
The addict, yeah. But it's still a hurt.
Oh, it's so hard for you to separate the two, especially if it's somebody you love.
Yeah, the mom just turned to me and she said, that's my life the last 5 years. And she was kind of, well, obviously very worn down by it, but she and her husband were on the same page. They said, okay, it's up to you. See you later. We love you, but we're out of here. Treatment's all up to you. And don't bother calling or coming home until you've, and
you've made a decision to get help.
Yeah, exactly. So, but it's a kind of being on the same page, lots of support because of the guilt. The addict is going to lash out and try and break everything down and get what they want out of the situation again. And what I see, what do you think that I love you text was about? I love you, and then nothing else. What was that doing?
My mom said it was for herself, and for my dad it was for themselves.
To do what?
To give them solace that they know that this was a decision out of love, that they love me, but they're afraid that they're hurting me any other way.
So all right, so in a way...
It was a very loaded I love you.
Well, it's so hard to do this, but to separate the addict and the addict's behavior from the person that you love so much, and some people just can't stand the manipulations, or they're so vulnerable to them that they just completely throw the addict out of their lives, or they go far, 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 far away. And to stay close enough to express love and maintain loyalty to the connection for the daughter or the son or the loved one that they love takes a lot of work, but it does take enough closeness where they can also be very mean, and it's kind of like a battle, but you hang in there trying to focus on the person that you love, not their addiction. And sometimes that's all it is that little thread that I love you, Alyssa, in there somewhere, right? Yeah. It's a tough thing.
There was no engagement of arguments. There was no, if I retaliated in some harsh words, I didn't get any responses.
Right.
They literally did the hardest thing I could ever imagine a family had to do.
So it's not like they didn't give up on you. That was a treatment strategy, I think.
No, that was definitely their hopeful call for action, like that I would be forced into a situation, and it worked. I mean, it took a while. I was very stubborn.
Okay.
Still am. But it took a couple weeks, almost about a month, before I finally called and asked for help.
Okay.
And then I'm sure that month of not knowing where I was, what I was doing, or anything like that was probably the most painful time for my parents.
Right.
And my aunts and uncles and cousins. But my mom still says this is the hardest thing she ever had to do in her life. Well,
and look at you both now. Right?
Yeah.
So there you go. Is that there's a lot. Even to say to a parent that we recommend that you do thus and so to the parent. It might feel like you're giving up on the child, but it's really a lot harder work to do something like this than to be jumping into the breach, to be fixing and rescuing and all those other kinds of things. Because really what's motivating the loved one to do all that work and to work harder at the person's recovery than they are is actually out of your own fears, your own guilt, your own worry. It's really not in the best interest of the person who's in their addiction, because they're not going to get better as a result of anything you're doing.
No.
Yet when you decide to do the right thing, it involves a lot of work and a lot of hanging in there, and it's just very uncertain. But we encourage, support that time and time again, you're actually doing something quite significant strategically for your kid. It might feel like you're giving up on them, but that's not, and of course the kid will accuse you of that, but that is not the case. It's not the case. You're doing
It's just a bunch of ramblings of an insane person.
Yeah, but they're very pointed.
I can vouch for that.
Very pointed ramblings. Okay. Well, okay. So that's really interesting. And it involves a lot of art as well as some clinical science and some knowledge of the field and all that kind of stuff.
I respect clinical work.
Yeah, it's okay. We're done with that. So at any rate, so the next thing would be, and we don't have to spend a lot of time on this today, but maybe a little bit, is how we help those parents when that loved one, when that kid or any loved one gets in treatment finally. Okay? So that's the next stage.
Both a family and a loved one should be in recovery at the same time.
Who says? And whatever do you mean by that?
Don't make me I know I've seen the research behind it.
Well, what do you mean? Okay, I'm going to play devil's advocate.
Oh, of course you are.
Listen, I'm not the one who's shooting heroin here. I don't need to be in therapy. This kid is the one who's been putting us through misery and ruining his life. What are you talking about me needing
Johnny's
therapy?
addicted to heroin and you're addicted to Johnny.
So you say. What do you mean by that?
How have your relationships been?
It would be great if he was clean. You know?
How was work?
Everything would be fine if this kid would just do what he was supposed to do, and I could
Seems like
focus.
Johnny's a lot on your mind. Pretty sure like heroin is for him.
Right now I'm feeling like you're messing with me.
I can't help because it's you. I just can't help laughing.
Well, okay.
But it's true. When every family I've ever worked with, I've always tried to coach them to see. Like my family really taught me this before I even started working in the field. Alyssa, you were the sole focus of my life. It interfered with my work, my relationships, my level of self-care. Like I couldn't take care of myself. I didn't think I could go out to eat with my friends without worrying if you were going to show up dead.
So what you're saying is your parents have been in recovery longer than you have.
Yeah, my mom has been in recovery from my addiction for a little over 12 years, and I've only been sober 10.
Okay. So that's a really good point. All right.
And it doesn't necessarily mean Al-Anon. She actually went to a clinically supported group that is continued on for 12 years with the same amount of families, if not more now.
Right. But going back to, approaching families that are kind of feeling that guardedness of having been judged or labeled, that how you tell parents or loved ones of people in recovery, early recovery, that they need to be in recovery themselves. It's kind of you don't just want to blurt that out, right?
No, I'm not just you need recovery.
Okay. So,
I usually, so a big part of how I am just as an individual and a professional is I always just try to meet people where they're at. I can read if somebody is going to be non-willing to appear to see or understand or go to a resource to that level. Mm-hmm. But I have that basic conversation. Where is your life at? What's your life about? You're calling me. You're chasing down his recovery when he's already in treatment or she's in treatment. Mm-hmm. You're still so solely focused. This is the time that you should be breathing. This is the time you should be getting good rest. This is the time you should go back to the gym or go fishing or see your brother.
Self-care.
Right. And I focus more so on just the behaviors of the conversation rather than going out and being you're addicted to your child and their care.
Okay.
And how it interferes with the loved one is when they're sober, it's not... when they're clean, when they come into recovery, the behaviors don't magically disappear.
Right.
And because you're fragile because of the relationship and the dynamic when they were using, you are going to be extremely, extremely sensitive to those behaviors.
Right.
And then that will start off arguments, and it will definitely,
Here we go again.
Right,
Going right down
yeah.
the tubes. Well, so
it'll take a long time to repair that relationship when they get into recovery. The level of trust on both sides just won't be there.
Well, sometimes what we find too is that clients are now in recovery and they're really embracing it, but the families aren't as invested in doing their work. And it's not that they necessarily wish ill on their loved one, but recovery is a lot of hard work. It requires a fundamental change, discipline, practicing things over time. And now the person who was the object of all these troubles now is kind of the wiser one with more experience in recovery. And the people that the others now are the ones that are kind of getting in the way of growth and change in the family.
Well, it's just like the loved one has to experience life without the sole focus on a drug or a drink, and now they're trying and they find other focuses that distract them that are healthier for them, but the family doesn't work on finding those things. They're still very much invested in the loved one that actually needs to be spending more time focusing on these other things so that they can be a part of the family. And it's a very weird, when you look at the dynamic, it's very weird and it doesn't seem like that works. Like, how can you be more of a family member if you're not around? Because they're rebuilding themselves to be more functional in the family.
Well, so one of the ways that I go about this is, I say, listen, whether or not you believe truly in, say, addiction as a disease concept, I will say this, that when any one person in a family system is addicted, it's going to infect other people in the family, or infest, if you want to use that word, and it's going to change everybody's thoughts, feelings, and behaviors to some degree or another. And I tell them that similar to gravity, like if you put a bowling ball in the middle of a trampoline, everything kind of rolls towards the bowling ball, right?
Yeah.
So, you like that?
I do.
And the addiction has a similar effect, is that it draws everything towards it and into it, and gets parents and loved ones focusing on the behaviors of the addict, and that is how the addiction spreads and also prospers, because if we're focusing on the addict's behavior, we're not focusing on the loved one, like those little I love you texts that you were getting. And the addiction loves it when it can divide and conquer a family. So what we say to parents is that we just want to steer you away from that behavior, get you more mindful of it, steer you away from it. And much more often than not, they're very grateful to be able to confess that they struggle with this and are looking for guidance and support, because they feel so guilty and they feel so frustrated and feel so hopeless at times. And of course, the addict does a very good job of pulling people into that way. But most people are very into hearing about how to defeat this dynamic and to reconnect with the person rather than their addiction.
It's not very often that you hear somebody, because as long as I think as professionals that we've learned over the years that it's not just a detached diagnosis. Like, you need recovery too. Because that does bring that judgmental feeling with it.
Anybody who says you need to me, I'm automatically
forget it.
not.
Toby's attacking you.
Well,
and he's a strong hockey player. He'll get you. He'll knock you down.
Whatever. But I will say that, that's one of the signs of people that are in their addictions cop mode. It's like, you need to do this, or what your problem
is.
And
as professionals, I think that we've grown away from that. We used to think that we had to have that conversation. We realized that it was no longer helpful, and I think that's really helped. And plus, the stigma in general in society has somewhat changed. I don't think that's huge. Not huge changes, not huge leaps and bounds, but to some degree there has been a lot. I've only been around 10 years, but there's a lot more local moms and family members and grandmothers and grandfathers and nonprofit organizations forming and speaking out about that. So I think that some have been able to feel more comfortable to seek help. I always say to the families, I'm like, look, your loved one has support, to know that they're not alone.
Right.
It's not bad for you to realize that you're not being judged by everybody.
Yes.
So it's painful to feel that you're alone in your struggle.
Back to kind of the art of working with folks. You know, I mean, I do have experience, I do have training, I do have all these things, but I want to try and be on the level with them as another human being rather than as an expert, you know, and that's, and I kind of bicker with the other clinicians about this. This is why I hate canned curriculums, because
I know you do, Toby.
Well, you know, it just.
I love it. I'm not judging. I love it.
I mean, there's great curriculums out there, but you know, people just want to connect with other people. You know,
Absolutely.
They don't need to be lectured.
Connection. They're saying connection is the opposite of addiction now.
Really?
There's a lot of people out there.
Who says that?
There's a lot of people.
I didn't coin that.
You can coin it. You can coin it. You
Well,
should have copywritten it.
Well, maybe in another lifetime. So, there's a lot of other things that we do and we talk about. I mean, parents are coming in with so many questions. I don't think we have time to get into all of that today.
Yeah.
I think that what you have helped me realize is, well, it's kind of an insight for me, is that a lot of the parents are struggling to help get their kids into treatment or loved ones getting loved ones into treatment. They don't even know it, but they're in recovery in that if they're engaging with other people around strategies, they're actually in the beginnings of recovery and trying to make something good happen here.
Yeah.
And that does involve some insight to self and how we can do and handle things better. Helping parents separate the behaviors of the addict from the love for the child, and that setting limits to addictive behavior does not mean turning off love for the child.
No.
Is so important because they need something to hang in there. Because when they set those limits, who knows what's going to happen?
Yeah.
There's a lot of scary possible things that could happen.
Of course, and when you're afraid, you think of all 1,000 possible things that could happen.
I mean, I have
negative.
3. Yeah.
Yeah,
right.
you have 3 kids.
I have all kinds of stories I can tell about dad's imagination run amok. And then the other thing I think is basically is that families just need to be connected with on the level and supported for their human struggle. And it's not so much facts and figures and lecturing them about family dynamics and enabling and all this kind of stupid stuff. I don't even like the word codependent. I don't even know what that means. You know, maybe co-occurring or co-addicted, but I just don't like the labels. I just want them to feel like it's okay to feel whatever they feel.
They're just parents. They're just human beings and parents.
Yeah,
Or loved ones, wives, husbands, cousins.
If
sisters.
nothing else, they have a place they can go where they're not going to be judged, and so much good can come out of that.
Yeah, well, they can call us. We'll help guide them into those avenues.
All right. Well, I promise not to judge them if you don't.
Never.
And you're not going to judge clinicians.
I don't have ground to stand on to judge anything.
All right. Well, all right. So anyway, we'll talk more about the details of what we do when we get folks in here the other time. All right. All right. Thank you. Salute.
Salute.
That's it.